Hello class, today we will be going over panoramic normal anatomy. So this will include bony landmarks of the maxilla and mandible, air spaces, and soft tissue. So please note that all of the numbers that you see in the diagrams coincide with terminology that's located in the notes section of the PowerPoints. So this is a really good tool that you can use to study for all of your different exams, both in lecture and lab. So all these numbers coincide with the list of terms at the bottom, and there's also another list that you'll see in the PowerPoints that I have included for you that has all of the terminology listed there as well. Please note that this terminology is every single word that you need to know, so make sure that you're familiar with these lists. So to start, our first diagram we will be going over is the anatomical landmarks of the maxilla and surrounding structures. So first, number 1 here, we have the mastoid process. So the mastoid process is a projection from the temporal bone located behind the ear. So because the mastoid process is a bony projection, it's going to appear radiopaque. Number 2 here, we have our styloid process. The styloid process is another projection of the temporal bone, and this is also going to appear radiopaque. Number 3 is our external auditory meatus. So this is a passageway through the ear. If it's a passageway, this is going to appear more radiolucent. Number 4 we have here, this is our glenoid fossa. So the glenoid fossa is going to appear radiolucent between the condyle and the zygomatic process. Number 5 is our articular eminence. So this is part of the temporal bone, and it forms part of the TMJ. Number 6 here, we have the lateral pterygoid plate. This is part of the sphenoid. And above it, we have the pterygomaxillary fissure, number 7. Number 8, and now the rest of the terms we should be pretty familiar with. Number 8 is our maxillary tuberosity, so located just distal to the terminal molar. Number 9, we have our infraorbital foramen, so that's up here. Please note that the infraorbital foramen, or our radiolucent foramen here, is located below the orbit. So number 10 is our orbit, and the infraorbital foramen is located below there. Number 11 is located down here, and that's going to be our incisive canal, with number 12 being our incisive foramen. Number 13, you can probably already guess, this is going to be our radiopaque anterior nasal spine. You can see how pointy it is there. Number 14 is going to be our nasal conchae and nasal cavity. So the nasal cavity will be this larger area here, this bilateral larger area that'll be radiolucent, and the conchae will be the diffuse radiopacities located within the nasal cavity. Number 15 is our radiopaque nasal septum. Number 16, located here, also radiopaque. That's going to be our hard palate. Number 17 is going to be this radiolucent area here, so that's going to be our maxillary sinus, with number 18 being the radiopaque lining of the maxillary sinus, so the floor of the maxillary sinus. Number 19 also will be radiopaque. That's going to be the zygomatic process of the maxilla. Number 20, that's our zygomatic arch. And 21, right here is our hook-like projection, so that's going to be your hamulus. So next we'll just go over some different panoramic images so you can see some of these structures as they would actually appear. It's important to know that when you're looking at a panoramic, you may not see every anatomical landmark that we go over. Sometimes you will, but a lot of times you won't. And this is completely normal not to see everything every time. So for example, on number 1, up here is supposed to be pointing to our external auditory meatus. Yes, it is located in this area. However, this is not a great image of it, and it's definitely hard to see here, which can happen sometimes on a panoramic radiograph. Number 2, pointing right here. So this here is our pterygomaxillary fissure. Number 3 is pointing to our infraorbital foramen. Now again, it's not the easiest thing to see, but you can see here slight radiolucency located just below number 4, which is going to be our orbit. Number 5 is a great image of our anterior nasal spine. So it's a great image. You can see, especially if you look at your skull models from orofacial structures, just how pointy this area is. So you can see this pointy projection here is our anterior nasal spine. Number 6, here's our nasal septum. Very easy to see again. Number 7 is a great image of our nasal conch. So that's going to be bilateral here. And then you can see around those as well, this more radiolucent area. So that's going to be our nasal cavity. Number 8 is this radiopaque area here. That's going to be our hard palate. And then number 9 is this area here. This radiopaque area is going to be the zygomatic process of the maxilla. So when you look at this, I can also see some other anatomical landmarks. So I can also see here my maxillary tuberosity. I can see my mental foramen. So when I look down here, here's my mental foramen, very clear on the right side. However, I go to the left side and I can't see it as well. And that's normal. Sometimes that will happen on a panoramic, that you'll see something easier on one side than you will on the other, which is why we say that panoramics are not always a good substitution for a full mouth series. On a full mouth series, we would definitely be able to see the mental foramen bilaterally. We would definitely be able to see more specific anatomical landmarks. We can also see here, here's our condyle, here's our coronoid notch, here's the inferior border of the mandible. So you can see we can see a lot of different structures here. In our next image, over here, number 1 is pointing to this radiolucent area. So that's going to be the glenoid fossa, this radiolucency. And number 2, pointing to our articular eminence here, this eminence bone. Number 3 is our maxillary tuberosity, located just distal to the terminal molars. Number 4 here is our maxillary sinus. Now the maxillary sinus, how would we know that number 4 is not pointing to the floor of the maxillary sinus? So please note that if this were either a test question or a quiz question, this question would also have to include something like, number 4 is pointing to what radiolucent area? So if I say radiolucent area, you know we're not talking about a bony area, so you would know that this radiolucency would be the maxillary sinus. However, if the question were to say, number 4 is pointing to what radiopaque area, radiopaque means we are pointing to that bony area. So radiopaque, the answer would be floor of the maxillary sinus. So always be very careful with that. And then number 5 here is, again, not the best image of this, but it should be the zygoma. So on this image, remember the last one we looked at. Look how easily we can see our anterior nasal spine here. It is not as clear here. So again, we can't always see everything on a panoramic. On this panoramic, what we have a good image of, though, on the left side is our mandibular foramen and our mandibular canal, which runs all the way along the mandible, housing the inferior alveolar nerve. So our mandibular foramen is located here, so that would be located on the lingual of the mandible if we were looking at our skulls. So next we'll be going over some more normal anatomical landmarks that we find on the mandible and the surrounding structures of the mandible. So number 1 here, this is going to appear radiopaque. This is going to be our condyle. Number 2 will be radiolucent. It's going to be the coronoid notch area. Number 3, this is going to be our coronoid process. Number 4, again, radiolucent. This is going to be our mandibular foramen connected to number 6, which is our mandibular canal, radiolucent. Number 5, going back, this is our lingula, so it's just that little bony projection there on the mandible. Number 7 is our mental foramen. So here's our mental foramen, that radiolucency that is not pathosis. Number 8 which is located down here. That'll be bilateral. Those are the hyoid bone. So you'll see the hyoid bone bilaterally down there. Number 9. Number 9 here is our mental ridge. So it's that ridge, so that'll appear more radiopaque. Whereas number 10 will be more radiolucent. That's our mental fossa. Number 12 and number 11 here. Here's number 12 is pointing to the radiopaque genial tubercle, while number 11 is pointing to the radiolucent lingual foramen located within the tubercle. Number 14, located up here, that's going to be our mylohyoid ridge. And then 15 and 16 are external and internal oblique lines. So remember, external oblique line is above the internal oblique line. Exit signs above the door. So that means we know number 16 is above number 15. So 16 is external oblique line, 15 is internal oblique line. So here on this panoramic, we can see very well. So number 1, here's our condyle, which then here'd be our cornoid process. So when we come along to the other side, number 2, here's our cornoid notch. Number 3, our cornoid process. And on this pano, we really can't see the cornoid process very well. So again, not every panoramic we're going to see every single anatomical landmark. That can be for such a number of reasons. It can be the density, it can be the technique, it can be the type of imaging. So it always varies into what kind of landmarks you can see. Number 4, we're looking over here, so that's going to be our mandibular foramen. Number 5, here's our other radiolucency, our mental foramen. And then number 6, this radiopacity, so this is our genial tubercle. And you can see the lingual foramen is that radiolucent area on the inside. And then we see number 7 is a great image here of our styloid process. When I also look at this panoramic, I can take one guess as to why they took this pano. Look at these third molars. They are some sort of impacted there. Definitely should not look like that. So here on this panoramic, so number 1 we have over here. So here's our mandibular canal. So that's going to run all the way along the side of the mandible, housing our nerve and blood supply. Number 2, you can see this slightly radiopaque area here. This is the hyoid. Again, not a great image of the hyoid. Some of them you'll see better than others in different panos. Number 3 here, we have our internal oblique ridge. And on this pano, you can't really see the external oblique ridge as well. In the next one, you'll be able to see it much better. And then number 4, here, we have our angle of the mandible. So here on this panoramic, here's our inferior border of the mandible. And then we have this radiolucent area number 2, that's going to be our submandibular fossa. So we have this radiolucent area because it's thinner bone that houses the submandibular gland. So number 3, here's a much better image of our external oblique ridge. So number 3 is going to be our external oblique ridge. And then number 4 isn't the best image, but you can see there's almost kind of this flap of cartilage tissue here. So that's actually going to be the soft tissue of the ear, which we'll go over again. In this panoramic, you can see very well the vertebrae. So you can see the vertebrae on either side of this panoramic as well. So before we talk more about the normal anatomical anatomy, you also need to know that you can actually see air spaces on panoramic radiographs as well. This is important to be aware of because whenever we see dark or radiolucent areas, we initially think, is this pathosis? However, it's important to know that sometimes it's not pathosis, it's just the appearance of the panoramic due to air spaces. And these are completely normal things to happen, so it's just important to know that they exist. So the 3 air spaces you need to know about are the palate-glossal airspace, nasopharyngeal airspace, and glossopharyngeal airspace. So here you can see on this panoramic, number 1 is pointing to our palate-glossal airspace, number 2 to our nasopharyngeal airspace, and number 3 to our glossopharyngeal airspace. And again, these are just radiolucent areas that show up on a panoramic for a multitude of different reasons, and you just need to know that they exist. The other thing that can also show up on a panoramic is soft tissue. So sometimes you can see shadowing from the tongue, the soft palate or uvula, the line of the lip, or the ear. So when you look at this image here, number 1, these bilateral areas are going to be where the tongue may be located or seen. Number 2, you might see some shadowing from the soft palate or uvula. Number 3, right in the middle here, is where you could see the lip line. And number 4 is where you might see cartilage from the ear. And in some panoramics, you can almost completely see the ear, so it's good to know that that's going to be there. So here in our last panoramic image, number 1 here, that's pointing to where the tongue would be. Number 2, that darker area where the soft palate or uvula would be. Number 3, and you can see the outline of the ear here, that would be the soft tissue of the ear. And that's everything for today's Kaltura lecture. Have a great rest of your day.